What is the caring medical approach to treating headaches? Well, like we always say, pain has a cause, so you always have to figure out the cause. Give you an example, somebody has headaches, but the headaches occur during the menstrual cycle. Well, obviously then you should work on, balancing the hormones. In that specific case, it normally is the woman has too much estrogen, not enough progesterone. And believe it or not, a lot of that you can correct with diet. So we cure a lot of people's headaches just from diet. So in other words, food allergies can cause headaches. If you eat the wrong kind of food, like say you're eating too many carbohydrates, not enough protein, that specifically will cause acid blood, and then that again can end up causing you to have a headache. Or it could screw up your hormonal system, like I just said, and then that of course causes headaches. A common question that I'll ask is, do you have neck pain before or during a headache? So if you, for instance, have neck pain, then you get either a tension headache or you get a migraine headache, which is like a squeezing sensation behind the eye on one side typically, then probably the cause of your pain is in your neck. The most common cause of headaches from neck problems is ligament injury. So the person most likely has a ligament injury in their neck. And you kind of know that if you're a self-manipulator, in other words, you move your neck to crack your neck, or you get a lot of chiropractic care, you probably got joint instability in your neck, so you're getting muscle spasm in your neck, and then that's causing a referral pain like a tension headache either back here or here. So the treatment of that obviously is to stabilize your neck. The treatment to stabilize your neck, of course, is prolotherapy. Prolotherapy is a very effective treatment for headache pain that's coming from the neck. Prolotherapy is also a very good treatment if your headache pain is coming from your TMJ joint, right? So if somebody has clicking of the TMJ joint, they have facial pain, they wake up and their mouth is all stiff, after a night's sleep, and then, their head starts hurting, then most likely, you have TMJ syndrome, which is causing your headaches, and you need the TMJ ligament or the TMJ joint to be stabilized, and the best treatment that we found for that is prolotherapy. Now, just being comprehensive in this interview, there obviously are people where they have a bite problem, and then there's certain things that lead somebody to know that they have a bite problem, but they might need bite equilibration. So I don't want people to get the notion that all we do for headaches is prolotherapy. I mean, everything has a cause. Everything has a cause. Give you an example, like for instance, sometimes the cause, it's a nerve problem. It's a nerve problem. So in other words, somebody just has, like tension right here, they have tension right here. Well, that could be because there's a nerve issue as it relates to this sphenopalatine ganglion, for instance, or your supraorbital nerve or your infraorbital nerve. So there are easy treatments for that. The treatment that we do is called neural therapy. So for nerves causing pain, then we would do neural therapy. When you have a ligament problem causing the headache pain, TMJ ligament, neck ligaments, then of course we would do prolotherapy.